The purpose of our program is to train excellent psychiatrists. We care really deeply about our patients and our residents, and we practice holistic care and evidence-based medicine. We're aiming to develop a workforce that reflects who we serve and can effectively identify and mitigate health disparities. One key element of our program is our strong focus on psychotherapy, which we think is an essential tool. So psychotherapy training starts in the very first week of your first year here. You will start seeing patients by the fall of your intern year and continue seeing psychotherapy patients of a variety of types the whole way through your training. Another key element of our program is the longitudinal structure. So learning theory shows us that repeat spaced exposures really help with content retention, and we've kept this in mind as we've designed the program. For example, in your intern year, you will have 2 days a week of outpatient family medicine, 1 day a week of outpatient neurology, 1 day a week of outpatient adult psychiatry clinic, half day a week of didactics, and a half day a week of psychotherapy clinic. And that same week repeats throughout the whole year, plus you're pulled out to go to consults or inpatient.
One of the key elements to our program is really giving residents the space to be able to explore their own interests. And one of the main ways that we do this here at Greer is to provide a variety of subspecialty clinics. And that can include a lot of variety in our core subspecialties, including reproductive psychiatry, child and adolescent psychiatry, geriatric psychiatry, and also addiction medicine. We also provide a lot of unique subspecialty clinics, including a media elective, a death, dying, grief, and loss clinic, and an outpatient eating disorder rotation hosted by myself. One of the really important things is that resident interests are not only fostered, but it might also make lasting change, because many of our subspecialty clinics have been inspired by ideas from residents themselves. One of the most important things that residents experience at their time at our program is getting to walk with lots of different colleagues and faculty members that have different passions and also life paths, which is incredibly important not only to figure out your own practice style and learn more about yourself, but also to really experience the depth of the human experience. One of the most tangible ways that we practice that at this program is a program called the Reflections and Expressions Group, where we meet regularly, faculty and residents all together, so that we can really support each other through the process of medicine and helping to figure out what psychiatry and medicine means to each of us individually.
One of the things that drew me to this program is the longitudinal curriculum. This is a really unique style of learning. There's also a lot of support from the faculty who are exceptional. They're supportive and encouraging of our personal interests, and something that's really important to me is advocating for the deaf, deafblind, and hard of hearing community, and that's something that I've been able to not only grow, but also integrate into my training here at Greer.
I enjoy the geriatric population and getting to work with them. And during that time, my programs allowed me to help build a geriatric intensive outpatient program. I see more geriatric patients in years where I normally wouldn't, and overall just help build my panel to what I want to be once I'm out practicing by myself. The culture of our residency program has been something that has drawn me here and also kept me here. Every single attending that I have is thoughtful, puts us first as residents, and really make sure that we're cared about while we're here. None of us were from the area when we started here, and that really created a great bond between all of us, and we have kind of become our own little family here.
What drew me to this area was the ability to live either in a rural setting, a suburban setting, or even an urban setting, and still be able to get to anything you need and whatever workplace in 20 to 25 minutes. Then coming to the program and meeting everyone and going through interviews, I was able to appreciate the warmth of the environment, the welcoming tone, and just getting a chance to be in a place that is a growing program. It was so exciting for me. As a resident in this program, you're able to experience a balance between work and life, which is great for anyone who hopes to grow a family during these important years. There's a warmth here that invites you to learn. You never feel uncomfortable when you don't know something, or if you need guidance in any way. There's always access to an attending and your colleagues and your senior residents. And I truly hope to pay that forward when I become an attending one day.
The piece of advice that I'd offer to people when they're considering our residency program is knowing that when you come to Greer Psychiatry, that we are a team and we work very closely with one another. When you're on that team, sometimes you'll be helping others, and then sometimes you'll ask for help, and you'll always be greeted with lots of hands saying that they want to help you. That teamwork attitude has been something that's been monumental to my learning here, and it's something that I hope to carry forward in my career.